Hello, welcome to our AMF Members Discussion Forum. I'm Fran Solomon.
And I'm Andy McNeil.
And we are thrilled to be your host for these forums. The AMF Discussion Forum is brought to you by Heal Grief, a social support network creating community after someone has died. Everything we do is inspired by our core belief that no one should ever grieve alone.
Our goal with this forum is to bring our community members an opportunity to engage with some amazing people and to discuss various ways to normalize and educate the community at large about the issues of grief. Our guest today is Dr. Katherine Shear. Dr. Shear is the Marion E. Kenworthy Professor of Psychiatry and the founding director of the Center for Complicated Grief at Columbia School of Social Work. Dr. Shear is a clinical researcher who first worked with anxiety and depression. For the last 2 decades, she has focused on understanding and treating people who experience persistent, intense grief. She developed and tested complicated grief therapy, CGT, a short-term targeted intervention, and confirmed its efficacy in 3 large NIMH-funded studies. CGT is strength-based and focused on fostering adaptation to loss. Dr. Shear is widely recognized for her work in bereavement, including both research and clinical awards from the Association for Death Education and Counseling, and invited authorship of articles for Up to Date and the New England Journal of Medicine. Dr. Shear, we welcome you to the forum.
Thanks so much, Andy and Fran, and thanks for having me, and thanks to everyone who's here.
Yeah, so
you want your original
conversation.
Just before we continue, we'd like to remind our audience to mute themselves. If our audience could please mute themselves.
So what time's he coming?
Let me see if I can start muting people. Okay, so can everybody hear me? Or did I mute myself? Okay.
No, you didn't mute yourself.
Okay. So, Doctor, for those participating today, how do you define complicated grief, and what inspired you to research and develop the complicated grief theory?
So thanks, Fran. That's a great question. And first thing I want to say is, could you please call me Kathy? I prefer that in this situation.
Okay. Thank you, Kathy.
The second thing I want to say is that the answer to your question, naturally, the answer to your question is complicated because one of the complications is that the condition that first got me kind of engaged in this whole process is no longer called complicated grief. It's now called prolonged grief disorder. And it is a formal diagnosis now it's a new diagnosis in the World Health Organization, even though I guess we don't belong to it anymore, but it seems important that it's part of the World Health Organization International Classification of Diseases, or ICD-11, which will go into effect in 2022, just so you know. But it also has just completed a very important round of discussion in the DSM, because it was a provisional diagnosis with still a different name in the DSM-5, but now it's going to be moved, almost certainly going to be moved into the body of the DSM-5 to be an official DSM diagnosis, and almost certainly will also be called prolonged grief disorder. So one thing is that the name has changed, but we still think that we do complicated grief therapy, which we've had to really think hard about, and we can maybe talk about later. But what this diagnosis is, fundamentally what it is it's a way of identifying people whose natural process of grief and adaptation to loss, both of those are 100% natural processes that everyone experiences. We believe, I think there's really good scientific evidence that both are in our biology, literally. That doesn't mean that we do them the same. Of course we don't. We know everyone grieves in their own, actually we would grieve every loss in a unique way, so it's not even every person. But the prolonged grief disorder occurs when something stops this process. There, I guess you could say we get in our own way, or something external gets in our way, so that we can't, the natural process can't move forward. And what that looks like is, I think, well described in the ICD-11, in which they say it's persistent, pervasive yearning, longing, or preoccupation with the person who died that is so intense that it interferes with the person's life, and is also considered by their social and cultural environment, their family, to be excessive. And it's accompanied by other evidence of emotional pain. But honestly, if the first part of that is recognized, is apparent, in other words, persistent, pervasive yearning, longing, and preoccupation, virtually everyone has additional evidence of emotional pain, because it really means grief has kind of got you by the ankles, and you can't move forward in your own life in any meaningful way. And that's really what we've targeted that's the condition we targeted.
Amazing. I just want to remind our audience, this is really about your opportunity to engage with Kathy and to ask questions. So if you have a question, please raise your hand, or please put something in the chat that you have a question. You'll unmute yourself, and then you'll ask Kathy the question yourself.
Kathy, I actually have a question just about, I know that that you started, in your work with anxiety, and then at some point, you think asked to do some work in bereavement and began doing some research. I'm curious, just from your perspective, when you first came into the bereavement field, or even just through any of your research, is there anything that surprised you in the research findings, or in what you discovered when you started, moved into this bereavement work?
So I guess the short answer to that is that I don't think there was anything that didn't surprise me, but and that was really because, like I think most mental health professionals, I had very little education or training related to grief itself. Of course, I knew that loss. I was trained in a psychiatric program that was heavily psychodynamic, and any psychodynamic therapist knows how important our close relationships are and how important the loss is. What they didn't seem to know, and still don't, honestly, many of them, is what grief actually looks like, and also and kind of even the underlying biology. And actually, before I even did grief research, just to be precise about this, I did a year of a psychosomatic fellowship with someone named Marion Hofer, who was studying maternal infant separation, attachment and separation. So attachment and separation is also in kind of my background, as is anxiety disorders, as you said. So other things that surprised me was, I think, really one of the things was how in a way how it wasn't as difficult as it seemed like it would be to me like it would be to work with bereaved people. It was kind of something I had to get over, because I was very afraid to do it in the beginning, and I felt completely like I didn't know what I was doing. But once we kind of did a whole bunch of things, one of the very important things that I did in the very beginning was to reach out to the grief counselors. I was in Pittsburgh at the time, and someone named Tamara Ballier actually was kind of my mentor. She was a wonderful community hospice counselor, actually, and she really helped me a lot start to kind of understand grief. I did a number of other things as well, but once we kind of started to put that together, it really did surprise me how how well people responded to a sort of gentle guidance is what we do. Yeah. But if that it was possible to gently guide people who'd been really kind of struggling with grief for years, sometimes decades, and get them to a pretty different place, they really got themselves to a different place, but help them get there in a fairly short time. That was a very, very surprising thing.
Yeah, thank you. Now we do have someone with a question. Let's see, Judy and Jamie. Do you want to unmute and introduce?
Hi, Kathy. My name is Jamie. This is my mom, Judy, here. She's a grief therapist. Hi. And I'm a future therapist. And first of all, Fran and Andy, thank you so much for organizing. And Kathy, thank you for being here. I'm curious to hear the relationship between complicated grief and complicated grief therapy and two dimensions. One of those dimensions is intergenerational trauma, and another dimension is spiritual health. Could you speak about the relationship between complicated grief and the therapeutic process in those two dimensions?
So let me, one thing I didn't say about complicated grief a few minutes ago is, all along when we've talked about complicated grief, lots of people have said, well, isn't all grief complicated? And I always said yes to that because we know it is. But now that we don't call prolonged grief disorder complicated grief anymore, now we can call regular grief complicated grief, because it's not always really complicated, but almost always, I would say, complicated. So that's how I see complicated grief today. So we can talk about either prolonged grief disorder or complicated grief, but right now I'm going to answer your question with respect to complicated grief in the way I just defined it, because I think it's more useful. Maybe you're nodding, so that's great, Jamie. One of the things that I think is really important in understanding grief is that it very often, if not always, has a spiritual aspect to it. In some ways, religion, one of the main reasons why we have religion, or the main purposes of religion, is to help us with that, with understanding. Sorry, a frog in my throat. A lot of times I might have to use a cough drop. I'll try to avoid that because it makes noise. But anyway, but along the way, another piece of this answer is that along the way, so there's always a spiritual component, and I think it matters a lot what a person's spirituality is, how they progress through adaptation is how I think of it, and sort of to let grief find a place in their life. But along the way, I met and started to work with a group in Pittsburgh initially. Now we're doing this work, we're continuing this work in New York, but this was a Black Baptist church in Pittsburgh, a very socially active Black Baptist church that reached out to us at the University of Pittsburgh because they were seeing a lot of grief, and they were growing very fast, and they were kind of overwhelming their capacity. And work with them led to a very in-depth discussion of something that you might call spiritual grief, which they said occurs in conjunction with sort of personal grief, whatever, the grief that we experience, personal or social grief, but it has to do with a loss of the relationship we thought we had with God, because the person's death just changes. For many people, it really is very profound and impactful. So that we developed an inventory of complicated spiritual grief with that group that Bob Niemeyer got very interested in, and he and Laurie Burke tested that instrument, but then they also modified it to, and I think rightly so, to be more inclusive, because we had really just worked with this kind of fundamentalist Christian group. So there are other perspectives, but I think the basic premise is the same, if that makes sense. And now I've forgotten what your other question was.
The other dimension, thank you, Kathy. The other dimension was intergenerational trauma.
Yes, okay.
Grief and intergenerational trauma.
Or intergenerational grief, actually. So a couple of years ago at ADEC, Jack Jordan asked me to participate in a panel where he did a number of these panels, but over the years where different people explained their own grief experience. And I do definitely think there is such a thing as intergenerational loss, which in which I had a personal experience with because my father's my father's father, my grandfather, who I never met, died by suicide really decades before I was born. And I didn't learn of that death. I knew he died, but I didn't know how until I was in my 30s. And that's one manifestation, I think, of intergenerational grief, actually. My father's, and so that, but then another really important manifestation is, I think we're seeing a lot of and talking a lot about now, which is racial, which is connected with racism. It's part of the whole protest movement, et cetera. But I think there is in the Black community quite a lot of intergenerational grief, and very, very important. And I don't know if that fully answers your question, but
thank you.
Yeah, I wanted to make even a comment on that. I know that a number of families, when I was providing direct service to families over the years, it was almost as if people had, the folks in their head, they had this agreement with God, like in their own mind, that, as long as I do these things, then, these bad things aren't going to happen. And when something does, that's that, what I saw, that people would come, and it's not just a thought in their head. It's a deep struggle with how they understand themselves spiritually, and how they understand the world to work. Really, it's part of that. So,
and often a disappointment in God.
Yeah.
After they've done all these things to pray and be good, and then their loved one is still taken away, it then becomes a disappointment. Go ahead, Kathy, please. No,
well,
please.
I just wanted to say that the Baptist ministers I worked with called that spiritual immaturity, and not meaning it in a disparaging way, but that. And so that would mean that the loss provides an opportunity for spiritual growth, really, in spiritual maturation, because that is kind of part of what you, I think, see in the Bible. And I think it's, it certainly is very impressive. The intensity of grief is very impressive.
Well, and I know, Kathy, you and I had talked at one point, had a conversation about how grief is not anxiety, and grief is not these other things. It's its own thing. It's this
right.
It's this experience that is in and of itself. It's not depression. It's not, and to attempt to provide support or care or treatment for grief as you would these other things, you're missing something. I remember us having a conversation about that. I wonder if you could talk a little more about that idea.
Well, I totally agree with what you're saying. Can you ask a little bit more focused question about that? Because
yeah.
I can answer it in so many different ways. I'm not sure exactly which is the most meaningful.
Yeah. So
Andy, before we do that, we actually have a question that's coming in from Marva. Marva, can you unmute yourself and show yourself?
Yeah, I see Marva. Hi, Marva.
There you are.
Hi, good afternoon. I am from Guyana, that's in the Caribbean, technically in South America, but politically in the Caribbean. And teacher, I have no training in psychology. But about 4 years ago, after my friend died, and I saw the impact her death had on her 2 young sons, I decided to do some research, and then I came across this whole area of bereavement awareness. And I took it upon myself to let others know that this is something that exists and children do grieve. And I created a nonprofit. So throughout the past 4 years, I've been working with bereaved families, specifically children, and trying to meet their needs. Now, what advice do you have for somebody like me? I don't have a master's in psychology or PhD, like that. But I consider myself an expert by experience. So I think I know how to really be there for families during a difficult time. But I also want to take it a step further to be. So, what advice would you have for me, somebody from a country where this is something that is not talked about? I'm the first person to have a national conversation on this topic. Um, so, what advice would you give me? Because I want to get to the next level. I want to be a professional, certified, all of that. Yeah. So, what advice would you give me, and also what advice for me professionally, and what advice would you give me in terms like for the way I interact with the family, so that I don't do anything wrong? Because I'm really scared that even though I want to help, I might be causing some damage, even though I haven't had any experience like that as yet. Um, but I do a lot of reading. I read a lot of the research, but yet at the same time, I can't really connect to the Western culture because Guyana is kind of really different, and it's multicultural. We have lots of religions as well, and for the past 4 years, I've really been feeling my way around, taking notes, observing, and trying to create support services that will fit our culture. I hope that makes sense.
It all makes total sense. Marva, thank you so much for the question, but also thank you so much for the work that you're doing, the amazing pioneering work that you're doing that's so, so important. And so I think that my first thought as you were talking and asking that question was actually, what advice do you have for me? But that's that's another. And I do, I think it goes both ways actually. So, but that said, and that important thing said, I can say a couple of things. The first thing is, from what you've described, I really can't imagine that you are doing any harm. I think the way that you're approaching these families, and I think probably everyone on this webinar, and all grief therapists know that the single most important thing you can do, and the thing that everyone needs, whatever else they need someone to be there, be present with them, and listen to them. And if you don't do anything else, you're going to help them and you're not going to hurt them. So that's the principle I would follow. That said, it's not enough for some people. That's what we've learned. That is one of the things we've learned in the work that we've done, that some people have had years and years of that, even have tried different approaches, different people, and they can't get past some kind of of really, one of the things that we call them derailers at this point, but one of the things that's got them kind of caught up. And so it might be that they do need a little more guidance, but the guidance should always be gentle and connected to where the person is, never heavy-handed, never authoritarian. I mean, that won't help, but being able to provide that guidance. And again, the work, so we've actually translated the work that we did. So what we did is we developed a 16-session intervention, basically psychotherapy type intervention, which centered around 7 main themes or principles. And sorry. And recently, for a variety of reasons, I translated these into the acronym HEALING. So the word healing can provide a kind of overarching, guiding, structure for working with bereaved people. And I'm very happy to provide, Fran, you and Andy, with this, with our healing. We call them healing milestones, and the word derailers also can be used as an acronym to identify some of the kinds of complications of grief, which are present in virtually everyone. Like, as we were saying, that what makes grief complicated, the things that make grief complicated, that kind of are the confusing thoughts and the mixed feelings that are so natural in grief. Some of those are ones that can kind of get a foothold, and then they get people off track. So I don't know that, I mean, I think that's the other thing. If maybe you can use those healing milestones and or the derailers as a kind of loose guide to where you might want to, how you might want to work with people. And actually someone from the Victoria Hospice in Canada, this is Marnie Thompson, who's been working with us for a number of years now and does CGT. She's one of the people who does CGT and trains people to do CGT. And she is going to work with us to develop a rating scale kind of thing for this. I mean, it's a very simple one where we'll probably turn it into that. So I don't know if that helps, but and also I would invite you to, and anyone here, to contact us at the Center for Complicated Grief. We do have a website with a fair amount of information that's free of charge. We have some that we charge for, because even though we're at Columbia University, we do not get any support from the university to keep the center going. So we have to support ourselves in various ways. So it's my way of apologizing for charging for any of this, but in any case, we can also help you. We're very interested in supporting people in whatever way we can. So we have various programs to do that. And very, very interested in cross-cultural issues.
Marva, I wanted to just also mention, there's a whole community of people who work in bereavement that you can be a part of. And, it's been my professional home for most of my career, and have not only developed professional friendships, but many very close friendships and people who, I care about deeply, just in the field. So encourage that. I know some people have listed some helpful resources down in the chat. You can look there. There's some organizations they listed, ADEC, and others. So have a look at that.
Thanks for adding that, Andy. Yeah.
Yeah, we have a comment from Amanda Kifferly. Is that a question? Amanda?
Hi there. Sorry, I'm not able to do my video.
Okay.
I think it was more of I'm chewing on it and enjoying that sentence, but I haven't been able to move past it yet because I'm still chewing it over. It's the idea that all deaths are complicated, then made me feel like for most of my life I've been looking forward to an uncomplicated death, because I was looking forward to being able to process it with new emotions that I didn't previously apply, and looking forward to being able to feel comfortable with a death of someone versus experiencing all the other deaths I've had. And I wonder then if that leaves me thinking the deaths I've experienced have been traumatic and put them in a trauma category versus complicated. But for most of my life, I've been looking forward to an uncomplicated death. So it was an interesting piece of information. So that's it.
Well, just to clarify, Amanda, I wasn't saying all death is complicated. I was saying all grief is complicated. And I do think grief is, I mean, it's a good point. I think grief is usually complicated. I didn't mean to say it's always complicated, because I don't really think anything is always anything. And for a person like yourself who's really been focused on this and as you said, working on thinking about it and anticipating it and working through a lot of the issues around it, I would absolutely not say that it would necessarily be complicated in the sense that I'm talking about it. The sense that I'm talking about it is the mixed feelings that I think are very natural, and the confusing thoughts that I think also are very natural when someone we love dies. And so that's what I mean. And you might or might not, having prepared oneself, we might or might not still experience those mixed feelings and confusing thoughts, which is what I'm calling, I mean, complicated is it's a word. It just means kind of complex and multifaceted. It's not necessarily difficult. If you're expecting it and you accept it, it's probably not. It doesn't predict anything. It doesn't mean that you're going to be stuck in grief.
Thank you for that, Doctor. We have a question from Judy Austin, Durango, Colorado Grief Center. Judy Austin, hi.
Yeah, thank you all for doing this, and thank you, Dr. Shear, for being willing to share. I was just wondering, I am not familiar with the model, and I apologize for not being more familiar with it.
I'm sorry, Judy, I'm having a little trouble hearing you. Can you
possibly? Yeah, I have to lean in.
Okay.
Is it better?
Yes.
I sometimes forget that. I am not real familiar with the model, the CGT model itself, and I'm wondering if you could expand a little bit on the model and these acronyms that you gave.
Sure. So the model we use is that the loss of a loved one, to understand the loss of a loved one, we need to understand what it is we've lost. And so that means, what is it that is kind of entailed in a close relationship? And we use attachment theory, psychological attachment theory, as the sort of framework for understanding. Of course, there's lots and lots of ways to understand what is contained in a relationship, in a close relationship. But we use attachment theory because it has a tremendous amount now of supporting research behind it, scientific research. And what that means in sort of more everyday language is that the person, people we love provide us with a sense of safety and security in the world, because they're the people we can turn to when we're upset or threatened or something bad happens. We need to problem solve something, and they're there for us, and they can help us do that. And they're also the people who are our kind of home base, so to speak, or safe haven, we call it sometimes, when we go out by ourselves in the world and learn new things and do all kinds of exciting things in our life and meet new people, whatever it might be. We know we have that home base to return to, and we know that the person who is that home base is also kind of has confidence in us. And so those two functions are really important, but it's really more than that. These are also people that we can pretty much count on to be rewarding to be with. It feels good to be with a person that we love, and all things being equal, we'd rather be with them than be separated from them. And then in addition to that, it turns out, and this is some of the interesting research that's been done over the years, but it turns out that our close relationships also play a role in all kinds of psychological and biological, physiological functioning. And so when we lose a person, when we're suddenly separated from them, and I'm saying sudden because all deaths in some sense are sudden, because there's life and then there's not life, and when that happens, even when we're anticipating it, we lose all of those functions. And so you can map, and actually the other thing about attachment theory is that it's part of a larger theory of what's called biobehavioral motivational systems, and included in those are the mirror image of attachment, which is caregiving. So that in order to have that person who is the safe haven and secure base, somebody has to be providing it, and we're actually kind of biologically motivated to provide those functions. We call that the caregiving system. And it turns out that for adults, and I think if you ask yourself if this is true of you, it's probably true, it's even more important to feel that you're an effective caregiver than it is to feel that you have someone who's going to provide that function for you, especially as an adult, And so there's the attachment caregiving, and then we also have a natural biological motivation to go out into the world, to explore things, to learn new things, to meet new people. We all have that natural inclination to do that. And that is actually also linked to, all of these are linked together. So when attachment is threatened, we no longer want to do that. It sort of inhibits that natural exploratory system. So we understand grief, and I could map it out, but I take too long right now. But really, you can explain, pretty much all of the thoughts, feelings, and behaviors part of grief by mapping onto that what's known about attachment and what happens when we lose an attachment figure. And so we start out there to try to, our model is to basically consider grief as the natural reaction to that loss. Plus, the other thing we know that happens when we lose someone close is that all kinds of other things change in our life. Sometimes people call these secondary losses. I kind of tend to think of them as changes because, I think it's semantics because it's probably the same thing. But in any case, we are going to also be responding to those other changes. And so the grief response is, the way that we see it is, it's the in the moment response to wherever we, to the experience of the loss of the person and all the associated other changes that occur. And it naturally, as I've been saying before, includes, among other things, it includes these kind of complications. It includes complicated thoughts and feelings. That's all. Mixed feelings, confusing thoughts. That's just natural as part of, because it's the nature of the beast, so to speak. And so we have this, what we call acute grief response, that is not one thing. It's variable. It's certainly variable between people. It's also variable within a person over time. And we also have, and that's triggered by the changes that occur, which is the losses that occur. And those changes also naturally trigger an adaptive response, because that, again, that's just part of how the attachment system works, and also how living things work, because we adapt to changes. That's what we do. Not only us, animals, plants, whatever, any living thing adapts. So the adaptive process in the case of grief, we have drawn on, for example, Strobe and Shouldnt, the dual process model. We've drawn on sort of more general thinking and observations about adaptation in loss. And the way we understand it is, there are two main overarching things that we all need to do in order to adapt to a loss, and that is, one of them is to accept the reality of the loss. And again, we're going to do that in our own way, our own time frame, our own way. And there are lots of different ways we can do that. And that means, though, accepting a changed relationship with the person who died, the fact that the person died, the person's gone and not coming back in this world, at least. And so we have a changed relationship. That grief is going, because we've lost them and because we are not going to stop caring about them, we are going to have some form of grief with us for the rest of our lives. It's not the same as in the beginning, but it's there. So accept grief into our lives. And then we also have to find a way to restore our sense of our ability to have well-being. And we define well-being using a theory developed in the 1980s by two psychologists, Richard Ryan and Edward Dietschy. And that's self-determination theory, and they have posited as their theory that in order to thrive, all of us need to have a sense of autonomy, competence, and relatedness. And this again has been widely studied and validated. And so that's how we see that, we have to find some way of connecting with our own intrinsic interests and values, and doing things that, at least some things in our life that are consistent with those. That's what they mean by autonomy. Competence is feeling that we can face and meet important challenges, and relatedness means that we have a sense of belonging and mattering in the world. So those are the things that comprise adaptation. And then, how do we do that? There, we sort of break that down into those 7 themes. That's what we focus on in the treatment. And it's through, and as the adaptation process occurs, grief kind of quiets down and eventually finds a place in our life where it can help us grow and learn and or stay out of the way most of the time. But we know that, pretty much everyone will experience times in their life after their grief is, in a sense, well integrated, where it kind of sort of pops up again in a pretty strong way. And that's, again, very, very natural. And it's one of the things that I deal with in my clinical work, because my colleagues call me and say, I have this patient I've been working with for years, and, and we're making a lot of progress, but something or other happened. And all of a sudden, now I realize they've had unresolved grief all this time, because now they're feeling a lot of intense grief. But I don't see that as unresolved grief at all. And this is what I generally am able to help them see, because this is the way it plays out, because I explain all of this to them, and I say that, grief is always there, and there's certain, under the right circumstances, it will become intense again, and that does not mean they have unresolved grief. It might be an opportunity to work through some issue in their life, might be, or it might just be the natural reaction to, my child is graduating from high school and my spouse isn't here to see that. And I mean, who wouldn't feel an upsurge of sadness in that situation, right? Doesn't mean that's just the way it is. And so, we support the person, and it takes a few days, and it's kind of, it quiets down again. So I'm sorry to be so long-winded.
No, thank you for that.
More or less answers your question.
Thank you for that. We do have another question, but just briefly, I just wanted to make the comment. It's interesting what a challenge it is for many people to make a paradigm shift in their own mind when they're grieving, that a lot of people think of their destination in grief as, I need to get rid of this grief. I need to get over this grief, right? And to make that paradigm shift to, wait a minute, the destination isn't getting over it. The destination is adapting it. And that's a different, I think a different message than just in general, I think society teaches, right? That it doesn't necessarily teach that, but then that sense of adaptation is sort of that natural, we're adapting all through our lives, right? Like that's just that natural process.
Actually, there's a wonderful poem by Denise Levertov. It's about, she sort of makes grief analogous to a stray dog that needs to become her dog, but it's really beautiful. I think that makes that point. Maybe I'll send that to you. You can do what you want with it.
I'd love to have a look at that, Kathy.
Yeah.
I think Judy has a question.
Okay.
I want to open this up to a bit of a discussion about the denial of death in our society. And had this been 6 or 7 months ago, Kathy, I just would have engaged in the kind of discussion about how many days off do you get for a good friend's death? None.
Right.
Or something like that. But now I'm wondering if COVID has opened up our society in some way to more of an acceptance, or whether you see people partying on a beach, are they in a denial of death or some other behavior? I don't know. So.
Yeah, great questions. I mean, it does seem like, I would say two quick things in answer to that important point, Judy. It's a great point, first of all, but also I do think that everyone is all of a sudden willing to talk about death and dying and grief in ways that I haven't seen before. And, I think all of us who do work in this field are experiencing, a lot of interest in the work that wouldn't have been there a year ago. And the other thing is, though, that I do think that there are still people that we want to, I don't know, we don't want, death shouldn't be in our minds all of the time. I mean, none of us think it should be in our minds all of the time, or at least not center stage in our minds. But, so when should it and shouldn't it? And I think young people in particular, it's very natural for them to have trouble wrapping their mind around it. I mean, it's much easier as an older person when the reality is kind of like close enough that you can't really, you know, and also it's a life stage that you need to deal with it. So, I mean, I do think it's very, very unfortunate that there are people partying on the beach, but I do think almost all of those people are young people. So
some of them are governors of states.
Well, that's true. And some of them are presidents of the United States too, but but they're kind of the outliers, I think. But no, you're right. I don't know the answer.
We do have a couple of other questions. Virginia has a question, and I know Kevin has a question. We're actually coming up toward the end of our hour. So Virginia, if you want to jump on and ask your question, and then Kevin, if you'll go, then we'll have those kind of be our two final questions here.
Okay, if I could, I just wanted to add something because I co-host a death cafe, and we're doing it on Zoom. So anyone can join, and anyone can find a death cafe in your area. And if you're interested in learning more, you can go online and find out. I don't know if we have ours posted on the international website, but these kind of conversations are always there. My question was, do you find more of this, what's called complicated grief or prolonged grief disorder with people that are experiencing disenfranchised grief?
That's a great question because I guess I don't know. I'm not aware of any studies of prolonged grief disorder in people with disenfranchised grief, and maybe that's partly because while we all know what that means, I'm not sure we have a clear definition, you know, kind of an operationalized definition of it that everyone agrees upon, you know, so that we can decide whether someone's grief is disenfranchised or not. Like, for example, I mean, we certainly have seen people with what I think you're referring to in our studies. Like I remember a young person whose fiance had died, and the family of the fiance basically excluded the bereaved person, the bereaved partner, essentially from all of the families.
I was thinking of the LGBTQ community also.
Okay.
Where it's not as much now because marriages are allowed and insurance and all that. But when I first started in the field, it was huge.
Yeah.
And it was huge in that particular population because of no acknowledgement of the relationships that had been going on for years.
Yes, absolutely. It's an excellent point. And I'm sure it does. I'm sure it's related, yeah.
I was going to say, Kevin, do you want to unmute and ask your question?
Yeah, thanks so much for your wisdom, Kathy, your experience. Just quickly, I'll give you a little bit. You mentioned unresolved grief. Now, this is, please, it's not a contradiction, but my own personal life, I was an alcoholic. I've been sober 40 years. And when I stopped drinking, all that emotions and whatever else came up into me, and I wondered what it was. And at times I wanted to commit suicide. But I discovered grief, you know, and I looked at the Grief Recovery Handbook. I followed that for a long time. But my sister's death came up. I was only 7 when she died at 26, and that came up and that haunted me for years. And I thought, why is it doing this? Now, being in AA and ACA, Adult Children of Alcoholics, and whatever else, not one of them knew how to grieve. They didn't even know about it, you know. They didn't even know how to do it, and neither did I, you know. In Ireland, you see, when somebody dies, they put the coffin across the window, and they all drink and sing. That's called a wake, you know. And I used to wonder, why are they doing that, you know? But I had to take action in my own personal life, and I had to learn a lot of things in grief, and I had to learn how to grow up and mature. And we've talked about maturity and spiritual maturity and all the rest. So what I had to do, I had to take action. And I mean, every day I had to take action. And I thank God that I had people that would listen to me, sit down with me and listen to me. And I do that today with other people. I have a certificate from Ireland for counseling, you know, and I put that I'm in the United States now at the moment, but you know, unresolved grief for me was terrible because then my mother and father died, and now all my brothers died of alcoholism, every one of them, and also came from a war zone from Northern Ireland, from Belfast, Northern Ireland, and I've seen people being killed there too. And I'm the baby of the family, and when I stopped drinking, all of that came up into my throat. You know, it was horrible. You know, and I had to reach out and ask people, you know, how do I do this? You know, what do I do? You know. One of the powerful things that I had to do was write. I had to journal. I had to write my feelings and emotions onto paper. And that was tremendously helpful for me.
Kevin, may we ask what the question is? Because we know that we're going to be having a hard stop at 11 o'clock.
Okay, well, what I'm trying to say is that about unresolved grief, you know, it's not a contradiction, Kathy, but it can be unresolved, and for people to not know about it. Do you understand what I'm trying to say?
I'm not entirely sure, Kevin. I don't know whether what you're calling unresolved grief we would possibly call prolonged grief disorder, possibly.
Okay.
That's what it's kind of sounding like to me.
Okay.
But maybe I'm not quite.
I'm sorry I
confused if anyone else has that.
Sorry I confused you, though. But,
No, I'm sorry I'm not understanding fully. I don't know if Andy or Fran has any clarity about that.
I'll make the comment that it sounds like, I mean, I think certainly how we choose to cope with things in our lives can certainly, grief may still be there. And I think what Kathy was getting at about grief being unresolved, and I sort of agree with this idea that I struggle with that term, and the reason why I struggle with it is because if the destination is to resolve my grief, it's really finding a way for that grief to coexist with that grief. And that's a struggle. It's a huge struggle. Anytime you struggle to adapt anything. So it could be a little bit of semantics as well, you know, that's happening here. But here's what it doesn't change. All of these words that we're using do not change the fact that, Kevin, your experience is validated, because that is your experience.
Yeah.
And we can use words. I even had someone one time said, I think grief lacks a language sometimes. So sometimes we can't find those right words. And your experience that you went through as a child and then found yourself, using alcohol or other types of things, when you weren't using those anymore, all of those things that kind of covered over, yeah, I could see where they came right back to the surface. So Kathy, I don't know if you had a final comment.
Yeah, no, I thank you for saying that, and thank you for sharing that story, Kevin. I think it's very poignant and important. And yeah, and that I think.
Well, we've actually reached the end of our hour, and I just wanted to give you just a moment, if you wanted to, Kathy. If folks wanted to connect further with you and with your work, how might they go about doing that?
So you can reach us at www.complicatedgrief.columbia.edu, and you can contact our center in that way, and there are, again, a whole variety of resources that we do have, including getting in touch with me personally if you want to. So
great.
You're welcome that. And thank you all for being here. And thank you guys for having me.
Yeah.
Anytime.
Kathy, we want to thank you so much for being a guest here in this discussion forum and for sharing your work with our audience. Thank you so much.
Very welcome.
And we
I
want
am
to
gonna
thank
have
all
to-
of you. Oh, go ahead.
Can I hop off?
Yes.
Yeah, yes, you can.
Yes.
I'm so sorry, but thank you all
Thank
really
you.
very, very much.
Thank you.
Thank you.
Bye.
And we also want to thank all of you who joined us for the discussion forum, where Q&As are possible. If you would like to learn more about Heal Grief, please visit us at healgrief.org. At healgrief.org, you can learn more about our programs and resources, including our national network of support for grieving young adults called Actively Moving Forward.
Make sure to join our AMF app so you too can be part of a community of others with similar goals and interests.
And this is
And
recorded, right?
so with that, thank you again for joining us, and we'll see you next time on the AMF Members Discussion Forum.